There is immense power when a group of people with similar interests get together to work towards the same goals. Idowu Koyenikan. The above saying has manifested in the Ikire Mercy Clinic Foundation that gave birth to Ikire Mercy Hospital. The health status of a nation is an investment that cannot be quantified. With this in mind of the members of this foundation, the health of the people of Ikire has been a theme of concern to this group of people that has continued to look for ways to improve the health condition of the people of the community, with particular attention paid to the vulnerable, less privileged, women and children. The journey of Ikire Mercy Clinic Foundation started precisely 2007 when a group of like minds came together to organize free medical outreach for the people of Ikire. The outcome of the medical outreach was a huge success.
Ikire Mercy Clinic Foundation goes far back in the making, as far as 2007. 2007. You can know how many years ago was that. And that happened when I was part and parcel of Ikire Patriotic Front. And we came up with the idea of health fair. And the health fair opened our eyes to what extent our people are suffering in Ikire, in terms of going to the hospital and staying for hours before they are attended to. They may go there for malaria and come back out with something else. And we did a little that we can do. That time, we assembled Ikire's nurses, doctors, and we did health fair. We did it at the Ikire Palace. And I can remember clearly, we give a lot of lectures. So when we did that health fair, it was obvious, because I can remember one elderly, I will call her Mama. She wore white. And it's so sad that when after the screening at now where we call center, I saw her dripping or soaked in normal fluid from the body, and she was extremely embarrassed. Though she was referred back to Lautech Hospital, because Professor Lighton was part of the committee that implemented that health fair. So this health fair, as I said, is the beginning of knowing that there's a gap in the health care services delivery for Iriwole sons and daughters, or Iriwole people and residents too, because I know some people came from as far as Akpomu Ikoyi to attend that health fair. It's like people really are waiting for somebody to care. So that went for a couple of years, and then I was resident, but that time outside the country. And it so happens that there's Uluode market in Oshogbo, and I used to drop or take my wife to the market where she normally grind pepper. I noticed one day a woman with facial tumor, so huge. But that time I couldn't do much of anything. So as soon as I go back to my base outside in the US, I asked Professor Lighton, what can we do for this woman? Now that I know financially I could be of help. And Professor Lighton said, why don't you ask her to come and see me at the hospital? There's a young man that used to run around, make errands for me. I sent that young man to go and locate the woman at the market, because I know she was in a permanent place. She has a shop. She had a shop next to where my wife normally grinds pepper. And sadly, unfortunately, I was told that the woman has passed 6 months earlier. That was very, very devastating. So there and then I called Professor Light and I said, this is not acceptable. There's no way we could let this go on. I mean, I was told that facial tumor is something that can be operated on. So just because of money and because of not having the opportunity to be properly screened or diagnosed, we lost a human being. I couldn't let that happen again. So I now told Professor Lighton that we have to do something more now that we are much elderly. And this idea of doing temporary health care intervention is not acceptable. Let's do a real thing. Let's set up an hospital. So that's how Ikire Mercy Clinic Foundation idea came about.
The popular saying that health is wealth can only be appreciated by that people that have seen what living in good and sound health is in developed climes to when compared to what obtains in our own country. 12 years after the 2007 medical outreach, the convener of the 2007 program saw the disgusting state of the health of our people in Ikire, especially the vulnerable ones, coupled with the high rate of poverty in our community, came up with the idea of having to tackle the challenge of the health conditions of our people.
Our goal is to provide the best healthcare services delivery for our people in Ikire and its environment. And then we started to put together a blueprint for Ikire Mercy Foundation mission or objectives, call it goals. In doing so, we listed clear path that Ikire Mercy, one, will make sure we provide affordable healthcare services for our people. Two, we will provide it with the best and highest quality in mind. Three, it has to be affordable in such a way that as we care for the VIP, we will also care for people that cannot afford it.
The founders of Ikire Mercy Hospital had same vision with Dr. Pedro Adegbola Odumuyiwa of blessed memory, the founder and founding medical director of St. Jude Hospital. With this, it was easy for the foundation to key into the dream of Dr. Odumuyiwa.
Aside from the 2007 health fair, commencement of health fair, how Ikire Mercy evolved is nothing short of miracle. We were looking for a location to house us, and my grandmother, my maternal grandmother, still has a premises that was vacant, and I thought we could use it. But then the committee thought otherwise and said we need something bigger, something that more befitting. They said, why can't we approach St. Jude? That is a big edifice, and we may be able to partner with them. And that's what we did. We went and spoke with Mommy of blessed memory, that is Mrs. Odumiwa, and the first daughter, Tayo. Lo and behold, they said, yes, as long as we are going to do what our father, Dr. Pedro Odumiwa, intended with that place. Because he could have located the same edifice in Lagos, in Ibadan. Why Ikire? Because of the people of Ikire. And that's how we got started. They gave us that place on lease.
The hospital in the last 5 years has witnessed a turnaround in all areas. This has greatly attracted patients and referrals from other healthcare facilities in and around Ikire. The hospital has significantly improved on what late Dr. Pedro Odumuyiwa left in St. Jude Hospital.
We have never looked back since, because we keep on renovating the place, we keep on adding value to the place. And we thought we are only going to be doing primary care. From primary care now, we are secondary care and tertiary care. To the extent that Professor Light, Dr. Mrs. Alaja Shekina Ojibanji, and Dr. Awowole, Ibrahim Awowole, Altogether, I've done more than 100 or so, about 100 free surgeries worth almost 6 million naira to alleviate a lot of our people suffering. Free! Professor Laitan will come there from 6, 7 in the morning and go at 7 at night.
Let's build wellness rather than treating disease. Bruce Daggy. With the above saying, donors to the hospital have continued to invest their resources to add value to the hospital in order to scale up the status of the hospital from the provision of primary health care to its present status of being a tertiary healthcare provider to a specialist hospital for the good of our people.
We are actually putting together now a main theater that will blow anybody away, and we want to be a what they call specialty hospital in the next 2 years. So in terms of involvement, we've gone from 9 people in 4 years to 35 people. And lo and behold, we've employed a lot of Ikire indigenes. I'm proud to say that a lot of people that have gone, either they japa, they've gone to start their own pharmacy or something of that nature. So yes, we have benefited tremendously from what they call human capital, because there's no hospital in Nigeria that can enjoy the human capital asset that we have.
Staffers in the hospital have also keyed into the vision and mission of the founders of the hospital, as their relationships with the patients and other members of staff have been said to be cordial and warm.
The workers here, it has been a very beautiful and nice experience, and I find out that the workers here, they could be able to do more if properly trained, and I see that they are very cooperative in all perspective. Normally every other business is supposed to have challenges, and because this hospital is a non-profit oriented hospital and non-governmental organization, so the challenges are that number one, how do you attract finance for this very special hospital, and attracting finance, and how do you manage the finance, and the kind of patients that come in, how do you manage them, and the staff too. So that has been the challenges. To be able to perform in life, you need a courage. So the courage is that you bring it or you create it by yourself. So this hospital needs courage to be able to work in it, and the donors have been very, very special, and the medallion members have been very special too. You have been receiving assistance from donors, you have been receiving assistance from medallion members. So by the special grace of God, we believe that this hospital will climb the greatest heights as one of the specialist hospitals in Osun State.
My experience with the people has been good. With my co-staff, it has been good. Although there were some few challenges, but we're trying to overcome them. With the management, I would say that they've been really helpful in putting things in place, putting some structure and getting everything in place.
I've seen a new level of patient than I've seen before. Considering the people of Ikire here, I've seen some kind of patients, and I've seen some kind of aggressive patients here. I've seen some who are more receptive to treatment, and I've seen some who frown out modern medicine, and to the extent of refusing to take drugs and medication, and even doing some tests when you order for it. With the staffs, it's been a family here. Like working here, I've had a lot of friends, a lot of people. It's a good working environment, it's a good life. And the management, though we've had change in the management at the administration level, but it's been fair, and there has been improvements in the management of the hospital.
They are kind and people of a good culture. That's what I would say from the patients that I've met over the period of time that I've been here. So, although we can also say they are financially challenged too, they are willing to listen and take advice. So.
Patients feel honored and treated with utmost courtesy by the personnel of the hospital.
Because ìgbà tí àbúrò mi ìyá tó jẹ́ last born wa tá gbé wá sí bíbáyìí ó jẹ́ 5% tó gbé dé bíbáyìí wọ́n dé attend sí dáadáa wọ́n treat in fact mi ò believe pé bóyá a lè ṣe bí hospital yẹn ní ìlú wa bíbáyìí because ó surprise nǹkan jọ yẹn ó jẹ́ 5% ó surprise.
ṣe dáadáa torí ó ní bí ọdún mẹ́ta ń sìn tó yẹ pé wọ́n lọ sí mi dé bíbáyìí tó yẹ pé àwọn èèyàn kan sọ pé mi mọ̀ pé mo lè survive rẹ̀ wọ́n dẹ̀ tọ́jú mi dáadáa emergency ni wọ́n gbé mi dé bíbá wọ́n dẹ̀ tọ́jú mi ọlọ́run dẹ̀ gbogbo àtìgbà náà mo dẹ̀ tún nígbàgbọ́ nínú wọn lẹ́yìn ọlọ́run pé tí mo bá débi ogun tí ń ṣe mí á lọ.
2 years mo ṣe wọ́n bíbá ẹ̀ but nǹkan tí according to àwọn èèyàn ọ̀pọ̀lọpọ̀ àwọn ọ̀rẹ́ mi wọ́n ti wọ́n bíbá yìí ti pẹ́ wọ́n dẹ̀ ní àwọn dókítà yín wọ́n máa attend sáwọn dáadáa. Ìgbà tí mo ti wọ́n rí báyìí mo rí pé àwọn doctors tó wà bí àti àwọn nurse tó wà bí ọmọlúwàbí ni wọ́n because there was a time torí general hospital ni mo ń lò tẹ́lẹ̀ torí pé mo ń sábà sick wasn't a wine ṣé o tẹ́lẹ̀ mo wá lọ síbẹ̀ wọ́n ṣe mí dáadáa mo ṣe bínú tí mo lọ mú aids mi tí mo mú wá sí bí báyìí ṣé o bá àwọn doctor yín bó ṣe ṣe sí mi àti àwọn nurse wọn ṣe ṣe sí mi join wọn ní emergency but àwa tí wọ́n rí pé tiwa wà critical wọ́n láti máa bẹ̀ wá pé ká má bínú pé ṣe a rí pé emergency ó wà ló jẹ́ káwọn ṣe bẹ́ẹ̀ ṣùgbọ́n àgbàmúdẹ̀ tí wọ́n bí báyìí wọ́n ṣe dáadáa wọ́n attend sí mi dáadáa.
The Ikire Mercy Clinic Foundation has gone a long way to meet up with the vision and mission of the foundation.
We have been able to improve on what Dr. Odumiwa intended. Now that hospital, by God's grace, is here to stay and is serving the people of Ikire. So we have come from primary to now we have sometimes people that are admitted. We are not a clinic, we're a full-fledged hospital.
Collaborating with St. Jude Hospital has been a blessing to all the stakeholders as aspirations of the founders has been met. Mrs. Tayo Akitaru.
I want to really thank God because for me it's a dream come true, because what has been in the mind of my parents when they were establishing that hospital is how Ikire indigenes particularly will have access to quality health care at affordable rates. That was what was in their mind. So I see the coming of Ikire Mercy Clinic as a dream come true because people can have access to quality health care and at affordable rates.
It is for all to join the train and keep this project going for posterity. This quotation by an anonymous philosopher is a message for us. We have to bring our own contribution if we want to make our community a better place. It doesn't have to be something huge. As long as you are kind and willing to help others in need, you'll be a great community member. Unquote by an anonymous philosopher.